Hello and welcome. You're watching Coronavirus Facts vs. Myths. I'm Rishika Barua. The Spanish media reports suggest that the country will now allow Pfizer as a second dose to those who've been given AstraZeneca in the first dose. This, at the moment, is for those under the age of 65 years. It's also happening since Spain, remember, had suspended the use of the AstraZeneca vaccine in those below the age of 65, leaving many stranded with just one shot of the vaccine. But this development is very interesting and it's raised lots of questions over vaccine mixing. So what is this study that's been conducted in Spain? Well, the CombiVac study, which is run by Spain's state-backed health institute, found that giving a dose of Pfizer to people who'd already received the first shot of AstraZeneca vaccine is not just safe, but also effective. There were 670 volunteers between the age group of 18 and 59 who already received the first dose of the AstraZeneca vaccine. These were the people who participated in the study. 450 of them were given Pfizer as the second dose. The study found that the presence of neutralizing antibodies rose 7-fold after the Pfizer dose. That is significantly more than the doubling effect that was observed after the second AstraZeneca shot. To make sense of these developments and what really does it mean for the world at large and especially for us here in India, we have Dr. Eric Feigl-Ding, a renowned epidemiologist and health economist, joining us from Washington. Thanks so much for speaking with NDTV. This is really the first study on mixing vaccines that's shown that a combination of the AstraZeneca and Pfizer vaccine actually works. It's safe and effective. What's your take on this?
Well, I think the first study on mixing vaccines is very promising. The Spanish study has shown that it is not only safe, it is also highly efficacious. If anything, the mixing with this Pfizer second dose might actually have even greater benefits than using both doses of AstraZeneca. In many ways, this was also a key issue to resolve for many countries that have stopped using the AstraZeneca vaccine for some reason or another because of the clotting, or stopped using it in certain populations. And those who were vaccinated with the first shot of AstraZeneca, what should they do with the second shot? And this answers the question, what should we do? That it is safe and acceptable to switch to the Pfizer vaccine for the second shot. And so I think that's really a good relief. And it also shows that switching the Pfizer vaccine to second shot actually yielded remarkably much higher than expected immunogenicity and immune benefits for the coronavirus protection. So I think this is a very hopeful line of study that perhaps we could mix vaccines to get even higher efficacy.
So what you're suggesting is that we've learned from this study that it's not just safe, but it could actually be more effective. But what about the dosing interval? Does that change?
So the dosing interval studies have been limited, but in the AstraZeneca study previously, we've shown that you actually have more immune benefits if you delay the second shot by 12 weeks than immediately giving it within 3 or 4 weeks. So I think it's safe, for the AstraZeneca shot to be delayed by the 12-week. Now, other vaccines, we don't have that delay kind of study on do we get better efficacy if we delay the second shot. But so far, delaying up to 12 weeks seems totally fine for the AstraZeneca vaccine.
But, if the benefit is actually greater, as the study is shown, by mixing these two vaccines, in this case, Pfizer, being given as a second shot after AstraZeneca, should we all get one shot of each? Is that going to be the way forward?
Now, that could be a finding. Let me be clear. It is possible that switching to Pfizer could get greater benefits. But the studies that compared AstraZeneca 2-dose versus AstraZeneca 1-dose, Pfizer 1-dose, are not from the same population. It's from a very different study, very different populations. It wasn't done in Spain. And so we don't know the admixture of elderly, not elderly, healthy, not healthy, different comorbidities. So it's a little apples to oranges comparison. But it could be that the Pfizer vaccine might be more beneficial. We just don't know for sure yet. At the current time, I think we should just stay the course, use both doses as available, and if you run into a situation where you are forced to switch for some reason or another, or if you're really concerned about clotting risk, even though it is extremely, extremely low, I think it's okay now, we can officially say, to switch to another vaccine. But I don't recommend it on a regular basis.
Okay, so it's interesting. You're saying stay the course, but if you have to, then it's safe to switch. So that's really the big understanding. But Dr. Eric Feigl-Ding, explain to us, why are we clubbing these two vaccines in particular, given the fact that they're developed on very different technologies? And do you foresee more vaccines to be clubbed in the future?
AstraZeneca is a very different vaccine from Pfizer. Pfizer is an mRNA-based vaccine like Moderna is. AstraZeneca is an adenovirus vectored vaccine similar to Johnson & Johnson and similar to the Russian Sputnik vaccine. They were in different classes, and hence they have different modalities. It's possible that the mixing yields different benefits, but we don't have all the different studies for mixing this and that. We don't even have studies on mixing Johnson & Johnson with the AstraZeneca or Sputnik. Right. So I don't want to speculate too much. This is why studies are ongoing, and this is why we're hopeful that we will have potentially more and more options in the future.
Right.
And in case of any shortages of any vaccine, that we won't have patients being stuck in a situation where they can't get their second shot.
All right, very interesting. How soon will we need a booster shot of the COVID vaccine? Are people who were, say, vaccinated 6 months ago still protected?
Well, I would say that the protection seems to last at least 6 months. We don't have further data because we don't have people vaccinated for longer than that for most part. I would say that boosters will be an issue if we discover that, for example, certain variants are highly resistant. Now, the only vaccine-resistant strain that we've definitively confirmed that is definitely a problematic for vaccines is the South Africa variant, the B1351 variant. Now, we don't have enough data on the Indian variant, although there's some evidence that the Indian variant has lower neutralization, but lower neutralization does not always translate to lower efficacy. So the jury is still out and undecided on that.
Right.
But someday, if we find vaccines that are problematic versus certain strains, such as South Africa variant, then we will need boosters. We are already developing boosters for the South Africa variant. Moderna, Pfizer, and almost every vaccine maker is already developing them. But whether they will actually be deployed will depend on how prevalent is the problematic variant.
Right. Are you essentially saying that a booster dose then potentially could be a tweaked version of the vaccine?
Yes. Booster shots are basically boosters for the variants, a variant-targeted booster. So because all the vaccine currently are designed for the original Wuhan 1.0 SARS-CoV-2 coronavirus. That was the design of all the vaccine spike proteins. But if the spike protein changes too much, that obviously creates vaccine efficacy problems. And that's what happened in South Africa variant. And so they've done already some preliminary studies that shows that if you design a vaccine targeted towards South Africa variant, it seems to perform well in neutralization against that variant, as well as against other related variants. So we're hopeful that a booster for the South Africa variant could have benefits, not just for that variant, but for other variants.
Right.
But those are still early studies. And whether we need to truly deploy it in the future remains to be seen, remains to see how prevalent a lot of these problematic variants will be in the future.
All right, Dr. Eric Feigl-Ding, thanks so much for speaking with NDTV. That indeed has been very insightful to understand what this study on vaccine mixing actually means. And of course, at the moment. Dr. Feigl-Ding maintains that you should stay the course, but if you have to switch vaccines, then the combination of the AstraZeneca and Pfizer has proven to be safe. At least preliminary analysis has proven to be safe. Let's now shift our focus to the other big story that we're tracking today, which is, of course, the fact that the government of India has asked all states to declare the mucormycosis or the black fungus as an epidemic. Now, why is this rare but potentially fatal infection more rampant here in India? And why should we really be concerned about it? Also, should we concern ourselves with the shortage of amphotericin, which is the injection that is used to treat it? Joining us to answer all these important questions on the black fungus, we have Dr. Arvinder Singh Soin, the chairman of Medanta Liver Transplant Institute. Thanks so much, Dr. Soin, for sparing your time. I want to begin by asking you, black fungus, why? I mean, there's been a lot that's been said about it. We've, had you on several shows explaining what it is, but break it down for us. India has declared this an epidemic, but it hasn't happened anywhere else in the world.
First of all, Rishika, mucor has been detected everywhere in the world, but not quite in the same numbers that we've seen in India. So it's not just an Indian black fungus. Secondly, this is an opportunistic infection, which means that it happens to people with low immunity, which has been seen for at least the last 50 years in other circumstances. Now, because of the COVID surge, and also the understanding that steroids can be life-saving in some situations, and this understanding has come through in the middle of the first wave last year. That's the reason that more and more steroids have been used. Also, the surge this time, the second wave, has been 4 times compared to last year. So the actual number of patients is much more. There are more severe cases this time proportionately compared to last year. And as you know, diabetes is very prevalent in India. India is probably the diabetes capital of the world. So because of all these factors, more steroids, more numbers, more severe disease, more diabetes, we are seeing more black fungus.
Right. But why are the cases disproportionately higher in India than anywhere else in the world? These cases have been detected elsewhere in the world. They are rare. They have the potential to be fatal. But it has been declared an epidemic here in India, which has not happened anywhere else. And there are now people who are suggesting that this could be due to a supply of industrial oxygen or oxygen therapy gone wrong. Would you agree with that assessment?
I think administration of oxygen therapy under non or unhygienic conditions is a factor, but not a major one.
Okay.
So my submission is that uncontrolled diabetes and overuse of steroids are the 2 main factors. In addition, if the orodental hygiene is poor, or if the oxygen therapy is given under unhygienic conditions, for example, the masks are reused or not washed, the tubes are dirty, if you secure oxygen in cylinders from uncertified sources, or if the water that's used for humidification is dirty. So that also creates a nidus for infection. That means it creates an ideal medium for this fungus to grow.
Right.
Because this fungus is present everywhere. It's on the ground, the soil, in the air, the fungal spores, which are ubiquitous. But they infect the human body only when the immunity of the humans is down.
Okay. Two quick questions, Dr. Soin. One, of course, is, we know that this is found in patients who've used or abused, misused steroids, especially in those who've suffered from severe COVID. Can they potentially pass on mucormycosis to a healthy individual who's not suffering from COVID?
No, this is not contagious.
Okay.
This will only be found in people who have uncontrolled diabetes or have been using steroids, large doses.
Shortage of the injection to combat COVID, how concerned should we be? Are there alternatives to this injection?
Before I go on to that, Shika, let me put things in perspective. So first of all, if it's spotted early, back fungus is treatable. It is also preventable. So ever since you all in the media and all of us doctors have actually started alerting people to the perils of uncontrolled diabetes and overuse of steroids, the actual abuse of steroids has come down. So I think we are preventing back fungus in the last 2 weeks much better than we did before. So it's preventable. The mild and moderate stages, the early stages, which affects 80% to 90% of the cases, is also treatable. Now, how do you treat it? First of all, you have to detect it early, and for that, you have to tell the patients who are likely to get it, which are typically patients 3 to 6 weeks after recovery from COVID,
Okay.
gone home, who've had lots of steroids, who have pre-existing diabetes or high sugars that came in just during COVID, but basically high blood sugar.
Okay.
They have to watch out for swelling and pain around the face.
Yes.
It first affects the nose or the mouth, and then it goes to the eyes and then the brain in rare cases. So you have to look for swelling around the nose, swelling around the eyes, crusty from the nose, bloody discharge, rough
Right.
discharge, some black crust on the palate or the torso, and these are the early symptoms.
Okay.
Goes to the eyes, then you can have blurring vision, you can have redness in the eye, you can have painful closing of the eye,
Right.
inability to close the eye or open it, and some pain around it and around.
Okay.
So once you detect it, you consult your eye doctor immediately. And then if you're given amphotericin B, 95% of the time you will recover. I mean, there were reports this morning which said that 7,000 in India have been, as you know, about 150 died. That's the that way. So obviously not that fatal.
Right.
And if detected early, it can almost always be treated. So let there not be panic
Okay.
around this.
But early detection really is the key in this case. So that's important. We're going to slip into a very short break at this moment. Dr. Arvinder Soin will continue to be live with us on the other side. You can call us on that number flashing on your screens and he'll answer all your questions on the coronavirus on the other side of a short break. Stay with us. Welcome back. We have our first caller, Mr. Tarvinder Singh, dialing in from Delhi. Go ahead, Mr. Singh, ask your question.
Hi, doctor. My age is 66 years. I am diabetic for the last 15 years, take on oral medication. Had allergic reaction to Novaquin some 40 years ago. Taking Ecosporin 75 for the last 15 years. Can I take the vaccination and which one if yes?
Dr. Soin?
Yes, you can definitely take the vaccine. Both Covishield and Covaxin are good. Whichever you can get, it's perfectly okay for you to take.
And none of these allergies are any contraindications, doctor?
No, the allergies are not contraindications.
All right. Our next caller, Sriram, is dialing in from Hyderabad. Go ahead.
Hello.
Yes, go ahead, sir.
Yeah, my name is Sriram. I'm speaking from Hyderabad.
Yes, go ahead.
Hello.
Ask your question. Ask your question.
Yeah, I want to know about the black fungus, which is said that it is coming from diabetes and sugar. Also, there was a chat which was going on right with this doctor. He says that it comes from the manuring. I also do little agriculture work, like manuring, kitchen waste, fungus, all those things.
Right.
Is it safe to work there or no?
Dr. Soin?
My age is 60.
Okay.
I'm
Dr.
hale and healthy. I have no issue at all.
All right.
Is it right to work in this field, agriculture field, with the manuring, cow dungs and other things?
Dr. Soin, is it safe for people working in the agricultural sector or those dealing with soil, for instance, or kitchen manure or waste? Is it safe at this time? What precautions should they take?
Yes, I think what you're doing is absolutely safe to continue to do. However, if, God forbid, you were to get COVID, you have to make sure that you control your diabetes well. And in that situation, for those few weeks, maybe 3-4 weeks, you should not be doing this work.
Right. So if you have diabetes...
Otherwise, it's absolutely okay to carry on.
Right, very interesting. So you're saying if you have diabetes and you have COVID, God forbid, then you shouldn't be doing any work with soil or gardening or dealing with manure, right, Dr. Soin?
That's correct.
Right.
Just for those 3-4 weeks.
Okay.
Until the COVID infection is there.
All right. Our last caller, Kumar, is dialing in from Bangalore. Go ahead.
Hello, doctor. I have a question for you. It was reported in the public domain today that 4 or 5 youngsters have contracted this black fungus, even though they had a very mild coronavirus and they were only on home quarantine. They were not even, admitted to hospitals. Now, they are not diabetic. They don't have any heart symptoms. But how then that they have got this black fungus now?
Right.
They have not used any steroids, nothing whatsoever.
Okay. Dr. Soin, that's interesting.
So I don't know the details of the cases you're talking about, but it is very likely that they had oxygen therapy at home. They may have had inhalational steroids, which is Butycort by nebulizer, prescribed by their doctors. And if so, then it is possible that, coupled with maybe poor orodental hygiene and oxygen therapy taken in unhygienic condition, that's the reason they got.
Right, very interesting. So you're saying that, the hygiene of the oxygen mask or therapy that's administered is also equally important, as
yes.
of course is, the use of steroids that should be under strict medical supervision. Thanks so much, Dr. Soin. I'm afraid that's all we have time for on the show today. We'll be back with more on the other side of a short break. Stay with us.